Welcome to another episode of Stories from the Edge of Life. We once again have a very special guest. We have Dr. Malarvizhi K Natarajan, all the way from India. Thank you for joining us today.
Thank you, sir.
Would you mind introducing yourself to our audience, please?
Yes. I'm Professor Dr. K Malarvizhi. I'm basically from nursing profession. I just came into nursing and I had some personal problems also, but still, I just was able to get out in a very good academic background. I just finished my basic nursing, and then I started as a lecturer or a clinical instructor in one of the college. Then I just proceeded to do board of studies because my teachers saw what I am in doing, which is extraordinary than the other students what they saw in my class. So I got involved without my post graduation in doing all board of studies work. The university recognized what I have done and they gave me a deputation for my post graduation where I worked as a faculty. Then I just finished my post graduation, and with my family life, I just got married, and I was getting settled in Bombay. There, I went to the hospital, and then again, the college where it was attached, I just got into. So I have around 29 years of experience in academics, and this lymphedema management, it was a part of my PhD. That's how I am here in front of you.
Great, thank you. And I'm Dr. Parag Bharadwaj. I'm a hospice and palliative medicine physician in the US. So let's talk about what got you interested in nursing in the first place.
Frankly to tell, I was so much interested in science subject, and I want to learn about our body as such. That motivated me, and frankly to tell, I wanted to go for medicine. When I didn't get the medicine seat, I was in the waiting list of 92. It didn't move much. Then my father said, instead of being a last person in medicine, why don't you be a first person in nursing? It's one doctor who motivated. He is my mother's doctor. So he said there is a course called as nursing. She can just go and still have what she had, the passion for medicine. That's how I came in nursing.
Great. So it sounds like you had the passion for science, the human body,
Yes,
and also serving them, right? So if not
yes,
as a doctor, at least as a nurse,
yes,
you just wanted to get in.
yes,
Yeah. So, and then you had people to guide you. Now, I was thinking the other way around. Before actually most people see the doctor, they end up seeing the nurses, right? Because even when you go
yes,
to a doctor's office and if you go to get admitted to the hospital, the doctor usually comes later on, but the nurses are the ones who provide the initial care to
yes.
patients. So that was very noble observation. Now, so what got you into lymphedema?
If I just see, my mother had a breast cancer when she was at the age of 28. She used to read magazines, and that's how she got to know that she is suffering from some disease condition, because this is in the early 80s I'm talking about. When she came to know that she is suffering from breast cancer, she underwent the surgery. But the same time, the 1 year after, she again had a relapse. After that treatment, she was fine for 12 years. Then she developed a swelling in the hand. And this was just getting aggravated. When I just went to each doctor, they were telling that there is no solution for this. And there were some times where I used to find solutions because I was in nursing. I go to doctors and check out, is there anything to be done? So they said that nothing, but you just put a crib bandage. That is nothing but your long stretch bandage. I didn't know at that time that that is going to be harming the patient as such. Because when we tell about this or bandages, it totally compresses because it's 100% elastic in nature, which I didn't know. When the doctor said, I also followed, but my mother's hand was swollen like anything. Then I started in 1999. when I had my PG post-graduation, they said I have to just do the thesis. I took this topic, but my teachers motivated me to just carry this topic when I'm doing my PhD, not at this time. Because these lymphedema patients will be at home. You can't get them at hospital very easily. And we have 4 weeks only as part of our dissertation. So then I thought that was just hitting me every time. I got married and I went to Bombay. I didn't get a proper guide. That's why I was waiting. Then in between, when I was shifting from Bombay to Bangalore, where I wanted to settle down, I joined a organization that is a multinational company called as Huntley Healthcare, where I got into so many places, hospitals and all. I was searching, is there any solution? I went abroad also. I went to Birmingham, UK, because this is a UK based company. I found out whether that company is having something. I got to know that Hydrovan is the apparatus, the lymphopress like. I asked them whether it is going to help. They frankly accepted this is not going to work because there is something required before you put this. I learned so many things out of that. And I thought, why can't I do something out of this? Let me start this topic for my PhD. So I just came to Bangalore. I started exploring. I went to my same university where I got graduated my post graduation. I started this, and when I was doing all this, I came across ACOLS from USA, which is conducting this program. That motivated me more that there is a solution for this. So then I learned to help my mother, but by default, when I was just finding the patients, I started implementing that. The outcome is very good. That's how I just got into this. And I thought with my mother's treatment, I'll stop and I'll continue. Actually, I am a principal of a college of nursing. So part-time, I was doing this PhD. Then the doctors who were giving the patients for me reference, they said that why can't you just help our patients? That's how I continued being in this lymphedema as part-time basis whenever time permits.
Great. So you had a personal experience at home, and
Yes.
that drove your passion to find a solution, right? And for the sake of our audience, could you just in layman terms explain what lymphedema is?
Yes. This lymphedema is nothing but is a swelling of the extremities. It may be extremities or any part of the body also, but basically because of the lymphatic system getting affected. This can be primary or secondary. Primary is where there is a genetic problem, where there are factors which is going to hinder the development of the lymphatic system. Secondary is basically cancer related. We have non-cancer related also due to trauma or any other reason where the lymphatic system gets damaged. With this, the lymph nodes are removed, especially in cancer. The tumor is removed. Along with that, the lymph nodes are removed because if you're not removing that, that will be spreading out. So when you're removing this, the drainage of that particular site extremity is getting affected. So there is a swelling which is developing. So this is really going to disturb the quality of life of the individual patient. So there should be a need for a professional treatment which will relieve them and improve the quality of life.
Thank you for explaining it so succinctly and accurately. Now, I know it's very frustrating when I've seen patients with lymphedema, right?
Yes.
And so, uh, because the treatments are not very easy and effective. So, can you
Yes.
tell in terms of how things have progressed from your point of view, and your faculty, you also the principal and nursing college. So, have you made sure that the managing lymphedema is a good part of the training that the nurses receive?
Yes. Actually, I should tell that it's my brainchild. When I got trained for this treatment or the lymphedema management, they taught me to manage lymphedema only. That is, after the swelling is developed. But with my creativity and things and all, I thought this is a tedious job for the professional also and for the patient also. Because when we start with the treatment, it goes from 4 weeks to 6 weeks if it is upper extremity. And if it is lower extremity, it is 6 to 8 weeks minimum. And every day they have to come for 5 days a week. The cost, not only in terms of money, it is in terms of time, and it is the time involvement of the family members to accompany them. It really matters. So then I thought, why can't we just do something like prevention? I traced out what are all the risk factors. So I just spoke with the team who was referring patients for the study of my PhD. So I spoke with them and explained to them, can we just prevent this matter? So while doing my PhD itself, I just developed a risk reduction brochure where the patients can know that what are all the risk factors and what are all the do's and don'ts, which is being given by the National Lymphedema Network. So I just followed that, keeping this in mind. When the patients are coming for follow-up to meet the doctors, they are sitting there and just getting restless when I will go to the doctor next. So can I use this window period, giving a brochure? During that time, let them learn what is this they can do from their side. So I started like that, started giving a brochure. It really worked out. The doctor said that they are aware about this lymphedema, the patients. Why can't we start with this? So my team was very supportive. They said that, okay, when we are doing the surgery, when I'm opening, I will get to know how many lymph nodes are removed and are the patient is going to be planned for radiation. These are the two major risk factors. So you start teaching this technique of manual lymphatic drainage, which is part of the complete decongestive therapy. And giving a sleeve, which is class 2, will help them to prevent development of this lymphedema. So I'm really proud with the support of my team members. I am able to prevent this condition, and I'm just blocking or nipping the bud at the early stage where the patient is not developing lymphedema at all, if they follow what I'm instructing.
That's very very well said, and I think yeah, if they follow, the compliance is a big issue, right? So we want to make
Yes.
sure that patients are following the instructions, you know, and yeah, we see that, when we prescribe medications as well, sometimes patients don't take medications as prescribed. So yes, following the regimen and instructions are very important.
Yes.
Now, the once the lymphedema occurs,
Yes.
with all these progresses that have been made in science and technology today, how effective uh, are the treatments in terms of either slowing down the further progression or treating the lymphedema? Could you enlighten us, please?
Sure, sir. If you just see what that preventive aspect I'm just dealing with, as I said, the compliance is more important if they are able to do. So I just give a video of what is this technique. I tell to them 5 components, even though CDT has 4 components. That is, one is manual lymphatic drainage, second is compression garment, third is exercises, fourth is skin and nail care. I included diet also because weight really matters a lot. Obesity has a direct link with lymphedema development. So if these patients take a small frequent meal, with my PhD study, I really worked out it helped the patients, and exercises really helps. So keeping this component, 5 components, I teach them, give them as a video. I take 1 hour time, and I do this before the patient gets discharged from the hospital. Because once the patient gets discharged and go out, we are not able to track them. So we give this by default, and the support system is really good because my doctors tell that what Malar tells, please follow that, you will be free of your complications. So if the patients are cooperative, the outcome is wonderful. Until now, I have just taken 150 patients for this preventive aspect. I think 2 of them only came back with development of lymphedema. The reason is they themselves accepted. We didn't even follow what you have just, or we didn't go through your video also. That really speaks that if they are following, they can get a very good quality of life. That's what preventive aspect. Treatment aspect, I don't know about other candidates who have got trained. I really thought in each and every patient I see my mother. So how best I can do? I just found out the training said that it is 4 to 6 weeks. So I used each and every time for them the best. I don't take more than 2 patients per day. I just give them the quality time. I plan accordingly what has to be reached. By end of 4 to 6 weeks, the patient has to be independent. They should not come back to me. I don't call them. Before that, I teach them how to do the self or simple lymphatic drainage and how to do the self bandaging also. They are really confident by the time they finish the treatment. I promise them that it will be 30% reduction from your normal extremity comparison. But I have seen that by the end of 4 to 6 weeks, 70 to 80% reduction has happened. And after that, the maintenance phase, they come forward. They wanted to ascertain that what they are doing is right or wrong. So they come for follow-up. I never say no because they also need that promotion. The family members feel that when you tell, they just listen. So I give them time. These are all the positive and the success for this outcome, I would say.
So just listening to you,
Yes, sir.
yeah. So just listening to you, what really impresses me is when you say when patients come back. So do they really come back because of the lymphedema, or do they really come back because, I think you're so welcoming, and the amount of your investment in them getting better is so,
Yes,
yes. I'm sure there's a psychological aspect
yes,
for
yes,
which they want to see you.
yes. The reason I will tell you what is the positive thing. I I'm a academician, but I wherever I worked, I see to that where the college is there, it has a attached hospital because I learned from my patients. That made me not to have a threat whether I'm going to shift from academics to clinical area. That gave me confidence. I salute to the teachers and the institution wherever I worked because that is the plus point for me. And that kept me in pace when I was dealing with lymphedema patients also. And I just meticulously took each and every aspect that when these patients, especially cancer affected patients, they have undergone so much trauma in their life. When they come to me, it should not be another one hospital situation. I was doing at home because I was doing my principal post and the responsibilities was too much. So I used to take one patient in the morning and one patient in the evening after I come back. It was in my house. I was just dealing with all these patients. Then slowly, when the COVID came, our apartment didn't allow this patient. So I started taking a house to treat these patients. So there is no name board, nothing. So my patients tell that when I come to here, we don't feel that we are coming to for one treatment. We are coming to your friend's place and the way how you show the importance and the relationship, it's like a friend only. That's what is the plus point I would suggest and feel that the patients are coming back to me.
Very inspiring. The power of great nursing care is what I'm hearing, from from the story that I'm listening to, and it's amazing. So, you also mentioned that the physicians saw this passion in you,
Yes,
right? And even after you did your PhD, they wanted you to be involved to care for these
yes,
patients, right? So, can you just share that account on your personal experiences in terms of how um, you went through this personal experience, but then at the request and suggestion of others, you found yourself in a position where you're now able to help others.
Yes, sir. I can tell about the doctor who was supporting me. To frankly tell, she herself is a breast cancer survivor. She has got her Limca book achievement record because she has just carried so many breast cancer surgeries. But she herself is a bilateral breast cancer survivor. That is my plus point. If I have any doubt in these treatments or anything, my two hands are, one is my doctor who is supporting me, and the other one is my mother. Any doubts, any product I wanted to test, first it goes to two of them. And their sincere feedback, I really take it and I just take that to the patients. And apart from that, all were supportive for me. I had hurdles. The Karnataka government was very supportive when I said that I wanted to do this at home care service, not in the hospital, my PhD. They gave immediately what letter you wanted to conduct this program or your study. We are ready. Usually, it's not very easy to get a government letter. That was a big support for me. There were hurdles for me, which again was a motivation that when they are telling like this, I have to overcome that. That became a challenge for me in my life. These all brought me into a very good success in treating my patients. And of course, my mother, she had different opinions about this treatment, but today she is hale and healthy. Whenever my patients come, they will have a doubt whether I can do self bandaging with one hand. Immediately, I'll call my mother and I'll tell, just do it in front of them. There is no words, they don't open their mouth also. We are also ready to do. This is how I motivated my patients. And I never call my patients as patients. Sorry to tell this, because this is the way how we understand. I tell my patients, please don't call yourself as a patient. You have been given a good name, call with your name. Don't own your disease. These are all the motivation. When they come, I'm very proud to tell that the persons whom I was dealing, they prayed for me during the COVID. You should not lose your life. We are praying for you because you may be having everyone, but for us, you are the only soul who can treat for us. That really helped me. And luckily, our whole family member, no one was affected with COVID. The blessings of these people really took us to the success. My mother had a very bad experience during that time because of her health condition, but still she survived everything with all these people's prayers and blessings.
What a story. Yeah, I think there's so many aspects to you. And one thing I really picked up is that you are always willing to stand up to any challenge, right? If you have
Yes.
obstacles, and I know it's like you mentioned very softly how it's not easy to get a government letter to do things,
True.
and I know there's a lot of bureaucracy and you have so many hurdles to to jump over, but yeah, it's amazing. If to me it sounds like if anybody says to you it cannot be done, you will make sure it gets done.
True. That is there. That is how I have done in academics also.
Yeah.
And with this aspect also, I'm able to do because I am a different person who want to achieve what I wanted to feel that it is going to help someone.
Very inspiring. And I always personally as a doctor, I feel nurses, I have the highest regard for them. And because we come in and we prescribe medications, examine the patient, go, but the minute by minute care is provided by the nurses. And often we, any good doctor will rely on a nurse to come up with a good treatment plan for the patient. So thank you so much for sharing your very inspiring story. And I would like for you to be back and
Yes.
just because you mentioned your professional journey, but there's a lot of personal uh, aspect to it. So love to hear that part. And so I look forward to that.
Sure. Thank you, sir.
Thank
Yeah.
you. Thank you very much for
Thank
being
you.
so
Thank you.
inspiring.
Yeah.
Thank you.